February is American Heart Month. Heart health is a vital factor in your overall well-being, and for those who are, for the most part, healthy, it is never too late or too early to start making the right kinds of choices. Dr. Sarah Schwertner from Primary Care Plus joins us to talk about heart disease and how to avoid it. Good morning to you.
Good morning.
So define it for me. What is heart disease?
So heart disease is basically when you have medical conditions that can affect the heart. Now, you know, the heart is the motor of the body. So it basically transmits all of your blood to your organs, the nutrients and oxygen to your vital organs. So basically, if you have a disease in it, you're not going to get what you need in your whole body.
Absent someone's defect, what causes, for an otherwise healthy person later in life, heart disease?
So one of the most common causes is coronary artery disease, and the coronary arteries supply all the blood to the heart. So if those arteries get full of plaques, you're not getting the blood flow to your heart, the nutrients to the heart, so that I can pump the blood for the rest of the cell to the body.
I'm going to take a detour on you, or as my wife likes to call them, going down a delta that we hadn't planned on. But there are tests you can take that will kind of show, you know, a carotid artery test. There's another, so you can talk to your doctor about possibly taking a couple of different tests that might give you an indication of early troubles?
Right, so a lot of times we'll do an EKG, an echo, and an echo is ultrasound of the heart, and you can see exactly, is the heart pumping normally, or is there something going on in the arteries?
Or a cardio score that can tell you maybe there's a
calcium buildup,
yes. And you might be on your way to having some plaque.
Yes, calcium scoring is nice too.
Especially if you've got a history of it in your family?
Oh, absolutely. If you have a family history of heart disease, then that's even more reason why you should get checked by your doctor every year.
So symptoms of heart disease, what should people think about?
Sometimes there's no symptoms at all, so that's why it's important to do annual wellness checks. But once you've come to a certain point where you are having a diseased heart, you might have shortness of breath, weakness, dizziness, swelling in the legs. Sometimes you'll feel a little sensation in your chest. It feels kind of funny, or even chest pain.
For people with advanced cases, I mean, you can get to a point where it's serious enough that you're beyond, there's a point of no return, if you will.
Sometimes there is, but we have seen patients that if they get their blood pressure under control, get their diabetes under control, get their cholesterol under control, that it actually, the heart can repair itself.
Okay, so and that's what I was leading up to, is for people who catch maybe some trends early, that's why it's so important to get that yearly checkup.
Absolutely. So if you get checked every year, you start early, you can prevent it from worsening, and then you'll have a happier life with a happier heart.
In terms of prevention, let's dive a little more deeply into that. You know, obviously so much of this is diet and exercise, as we talk about.
Absolutely. So, you know, you want to make sure you're doing at least 30 minutes of exercise 4 or 5 times a week. You want to make sure you're eating a heart-healthy diet, so things like whole grains, fruits and vegetables, salmon, tuna, some of the lean proteins, and that can actually prevent heart disease.
30 minutes of exercise. Okay, does that mean you get out and just run for 30 minutes, or what? How much do you have to do? How do you have to go at it?
You definitely want to do exercise where you're short of breath. A lot of times patients say, oh, yeah, I walk 30 minutes a day, and one of the biggest questions I always ask them is, can you talk to your friend while you're walking? Because if you can talk while you're exercising, you're doing physical activity and not cardio. So it's important to do something like swimming, biking, you know, running, things that get your heart elevated.
Gotcha. All right, Dr. Sarah Schwertner, good advice as always.
Thank you.
I'll be outside going up and down the stairs.